Introduction of hypertension. Hypertension is when blood pressure is too high. Blood pressure is written as two numbers, which is systolic and diastolic. Systolic represents the pressure in blood vessels when the heart contracts or beats. Diastolic represents the pressure in the vessels when the heart rests between beats. Hypertension is diagnosed if, when is it measured, on 2 different days. The systolic blood pressure readings on both days is bigger than 140 mmHg, and the diastolic blood pressure readings on both days is bigger than 90 mmHg. There are 2 types of hypertension: primary hypertension and secondary hypertension. For most adults, there are no identifiable cause of high blood pressure. This type of high blood pressure, called primary hypertension, tends to develop gradually over many years. Some people have high blood pressure because by an underlying condition. This type of high blood pressure, called secondary hypertension, tend to appear suddenly and cause higher blood pressure than does primary hypertension. Various conditions and medication can lead to secondary hypertension, including kidney disease, thyroid problems, and adrenal gland tumors. Hypertension is called a silent killer. Most people with hypertension are unaware of the problem because it may have no warning signs or symptoms. For this reason, it is essential that blood pressure is measured regularly. A few people with high blood pressure may have headache, shortness of breath, or nosebleeds, but these signs and symptoms are not specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. When symptoms do occur, they can include early morning headache, nosebleed, irregular heart rhythms, vision changes, and buzzing in the ears. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors.
Now, we are moving on to the drug classes for hypertension, including the mechanism of action and examples for each class. There are some drug classes for this disease, such as the first one, diuretics. A diuretic is any substance that promotes the increase in the production of urine. Diuretics help by decreasing sodium reabsorption, hence cause an increase in urinary sodium and water losses, which can help to control blood pressure. There are 3 types of diuretics. The first one is thiazide diuretics like metolazone. The second is potassium-sparing diuretic like spironolactone. And the last one is called loop diuretic such as furosemide.
Next, beta blockers. Beta-adrenergic blocking inhibitors, also known as beta blockers, are blood pressure lowering drugs and are mainly used to manage abnormal heartbeat. Beta blockers function by blocking the effects of the adrenaline like hormone called epinephrine. Beta blockers work by lowering the heart rate, workload, and blood output of the heart, thus lowering the blood pressure. There are 3 types of beta blockers such as acebudolol, atenolol, and bisoprolol.
The last drug class for hypertension is ACE inhibitors. ACE stands for angiotensin converting enzyme and is used primarily for hypertension and heart failure treatment.
ACE inhibitors help the body produce less angiotensin, which helps the blood vessel relax and open up, which in turn lowers blood pressure. There are 4 examples of ACE inhibitors medication like lisinopril and benazepril hydrochloride,
perindopril and ramipril.
Disease of hypertension. What is behavior or lifestyle change for hypertension? Lifestyle modification, also known as non-pharmacology therapy, is a platform to help hypertensive patients to achieve lifestyle behavioral healthy. Where 2005 recommend a healthy lifestyle to minimize the risk of hypertension with a combination of antihypertensive medication. Way of life change is an effective method of managing high blood pressure. It is also said that lifestyle change can slow hypertension and even prevent it. The recommended lifestyle factor to reduce hypertension is weight loss, weight gain, regular physical exercise, moderate alcohol intake, change in diet, and reduce sodium intake. The dietary approach to stopping hypertension is to eat lots of fruit and vegetables, low-fat dairy products, low in total fat, saturated fat, and cholesterol. The DASH diet has product effective result in lowering hypertension. A healthy lifestyle is very important for the prevention of high blood pressure and a good way to manage high blood pressure for people with high blood pressure. Normal maintenance weight plays a big role in the prevention and reduction of high blood pressure. Being overweight has a big impact at high blood pressure, then losing weight is an important method to manage and prevent high blood pressure. Thus, diet and exercise also induce reduction high blood pressure. For patients who are unable to maintain a normal weight, loss at least 4.5 kg is a good start to lowering high blood pressure. To being overweight not only increase blood pressure but also increase the risk of developing diabetes. A proper weight loss plan includes exercise and good nutrition. Therefore, it is important to exercise for 30 minutes at least 5 days a week. Exercise such intake is associated with increased high blood pressure. The study show that total salt intake is generally 9 until 12 grams per day. Lower to 5 grams every day will provide effective benefit to hypertensive patients. Salt restriction as well recommend to diabetes and chronic kidney disease patients.